What happens if HIV drugs are stopped for millions of people? ChatGPT said, if HIV drugs are stopped for millions of people, the consequences would be severe and wide-ranging. Antiretroviral therapy, ART, is the cornerstone of HIV treatment, and discontinuing these medications could lead to a series of negative outcomes. 1. Rapid viral replication. Without ART, the HIV virus can rapidly multiply in the body. ART works by suppressing the viral load, keeping the virus at low levels. Stopping the medication would allow the virus to increase, leading to a higher viral load and the potential for quicker transmission to others. 2. Weakened immune system. ART helps maintain and strengthen the immune system by keeping HIV at bay. If treatment is interrupted, the immune system becomes vulnerable to opportunistic infections and diseases that it would otherwise be able to fight off. People who stop their HIV medications could experience a deterioration of their immune system, making them more susceptible to life-threatening infections and conditions. 3. Progression to AIDS. If ART is discontinued, HIV can progress to AIDS, acquired immunodeficiency syndrome. Without ART, the immune system becomes increasingly damaged, and individuals are at high risk of developing severe opportunistic infections, like tuberculosis or pneumonia, or certain cancers, such as Kaposi's sarcoma. This progression can lead to death if untreated. 4. Increased risk of drug resistance. When HIV medications are stopped, there is a risk that the virus will develop resistance to the drugs that were being used. This resistance can make future treatments less effective and reduce the available options for managing the virus. 5. Increased mortality. Without access to ART, people living with HIV are at significantly higher risk of death. Studies have shown that individuals who stop taking their HIV medications have a higher risk of mortality due to the progression of the disease and complications related to opportunistic infections. 6. Social and public health consequences. On a larger scale, if ART is halted for millions of people, the global fight against HIV/AIDS would take a huge step backward. There would likely be a spike in HIV-related deaths, an increase in new infections, and a heavier burden on healthcare systems. Efforts to reduce the global HIV epidemic would be severely undermined, and the stigma surrounding HIV could also worsen, as people living with HIV would be more visibly ill. 7. Psychological and social impact. For people living with HIV, the discontinuation of their treatment would have a devastating psychological impact. Many rely on ART to maintain their health and quality of life. The fear of illness, stigma, and discrimination could become more pronounced as the physical and visible effects of untreated HIV emerge. 8. Economic burden. If ART were to be stopped for millions of people, the economic impact would be significant. Treatment costs for advanced HIV-related diseases, such as hospitalizations for opportunistic infections or AIDS-related cancers, would increase substantially. Additionally, the productivity loss from people who become seriously ill or die prematurely would have a ripple effect on families, communities, and economies. Governments and health organizations would face enormous financial strain to manage the public health crisis caused by the resurgence of untreated HIV. 9. Impact on HIV prevention programs. The global effort to reduce HIV transmission heavily relies on the availability of ART. Stopping these drugs could undermine prevention programs that focus on viral suppression to reduce transmission. When people with HIV are on effective ART, they have undetectable viral loads, which significantly reduces the chance of transmitting the virus to others, a concept known as U equals U, or undetectable equals untransmittable. Without access to ART, viral loads would rise again, increasing the risk of new HIV infections and making it harder to control the epidemic. 10. Global setback in the fight against HIV. The global goal of ending the HIV/AIDS epidemic by 2030 could be set back by decades if ART is stopped for millions of people. The progress made over the last few decades, such as lower transmission rates, higher quality of life for people living with HIV, and the development of more effective treatments, would be severely threatened. Efforts to promote education, reduce stigma, and improve healthcare infrastructure for people living with HIV would be hindered, and many years of work could be undone. 11. Increased stigma and discrimination. Stopping HIV treatment on such a massive scale could lead to a resurgence of visible illness, including wasting syndrome, opportunistic infections, and other complications. This could exacerbate the stigma and discrimination faced by people living with HIV, as they become more visibly ill and vulnerable. Social exclusion and misinformation about the disease could increase, leading to more challenges in accessing care, reducing prevention efforts, and fighting discrimination. 12. Unpredictable outcomes in low and middle income countries. For low and middle income countries where access to ART is critical, stopping treatment could be catastrophic. These regions have made significant progress in reducing HIV-related deaths through ART programs funded by global initiatives such as the Global Fund, PEPFAR, and UNAIDS. A halt in ART would likely result in skyrocketing infection rates and deaths, overwhelming already fragile healthcare systems. It would also undermine the international community's commitment to providing universal health coverage and sustainable development. 13. Potential for public protests and humanitarian responses. If ART is stopped for millions of people, there could be widespread protests, especially in countries where the HIV epidemic is most prevalent. Civil society organizations, healthcare workers, and advocacy groups might push for urgent humanitarian responses to restore access to life-saving medications. The global outcry could pressure governments and international organizations to act swiftly, but it would also demonstrate the deep vulnerability of public health systems in times of political or financial crisis. Conclusion: the cessation of HIV treatment for millions of people would lead to catastrophic consequences on both individual and societal levels. The resurgence of HIV-related illness and death, increased transmission rates, economic burdens, and social impacts would reverse years of progress in the fight against the HIV epidemic. This scenario emphasizes the importance of continued access to ART and the need for global solidarity in ensuring that people living with HIV receive the care and support they need to live healthy lives. Ensuring uninterrupted access to HIV treatment is critical not only for individuals but also for the future of global public health.